so that I don't forget. So we are recording this. I want to thank you all for joining us tonight for Family Service and Guidance Center Ask a Child Therapist question and answer service, or session, sorry. Like I said, we're recording tonight's discussion. It'll be up on our website. You can rewatch it, share it with others. We'll be sharing a lot of information tonight, so it'll be nice to reference it if you need to. You can view it and all of our past videos on our website, which was newly updated and went live this week. So we're really excited about that. You just visit fsgctopeka.com/parental-resources. I appreciate everyone taking the time out of their busy schedules to learn a little bit more about kids and ADHD. We'll be answering questions submitted by caregivers just like you all. I'm Megan Starbuck. I'm the marketing coordinator at FSGC. As you may know, Family Service and Guidance Center specializes in treating children of all ages who struggle with anxiety, depression, ADHD, and other mental health issues. We're excited to be offering this free monthly parenting Q&A to our community because we completely understand that parenting is not easy. So we want to help you by answering your questions about kids' mental health and other parenting topics. And we welcome your questions. We have some that were already submitted and we'll be answering those. But if anything pops up that you want to ask, feel free to drop it in the chat and I'll ask it tonight. Let's see here. I think that's all I have in my notes. I'm going to welcome Dr. Connie Romig. She's kindly agreed to share her expertise with us tonight, so I'll turn it over to her and she can introduce herself.
Hi, I'm Dr. Connie Romig, and I am a doctoral level psychologist at Family Service and Guidance Center. I've been at FSGC for 22 years now. I specialize in working with little kids, so 6 and under. I'm a registered play therapist. I also oversee our psychosocial program for preschool age children who struggle behaviorally or social emotionally in their community preschool setting. I also provide, I also do autism diagnostic testing at our agency along with other psychological testing. And so I've been around and I've been around a lot of kids who have ADHD. So hopefully I can give you some good information about whatever comes up with questions you have about ADHD.
Yeah, well, thank you. So my first question is somebody submitted was, my son struggles to bring home parent information, handouts, special competitions he's qualified for, assignments, events, fundraisers, and everything. He's 10 years old and his teachers will not send the information directly to me. They said he needs to be responsible for himself. Teachers compare him to other kids and do not recognize that it is not intentional. He's just slower to mature than his peers. As a result, I am punished because without the information, I cannot help him be successful. What is the best way to communicate to his teachers so that they want to and are willing to accommodate?
That's a really great question, because it really gets to the importance of having a good working relationship with other adults who are on your child's team, whether it's teachers, school staff, coaches, what have you. Organization and remembering things are common challenges for kiddos who have ADHD, but even kids who don't have ADHD have, struggle with some of these behaviors. So I feel like it's really important to communicate to teachers that Joey struggles with ADHD and that you're working on this. This is a goal for him. This is a behavior that you want to modify, and could really utilize the teacher's support and help in reinforcing these behaviors for your young guy. So I've worked with lots of different teachers and parents who made this kind of behavior a goal for the child to work on. I had a 6th grade teacher who had a student struggling with ADHD, struggling to remember to bring home materials, whether it's homework materials, handouts, any of those sorts of things. musical instruments, whatever. And the student was really embarrassed to be called out, like to have the teacher kind of hold his hand. And the sixth grade teacher also recognized, hey, he's a 12-year-old. We want him to start developing some of these skills on his own. And so most kids nowadays have a Chromebook at school. This teacher had the student set himself an alarm on his Chromebook at a certain time of day, and the alarm went off and a checklist came up that said, hey, start packing up to go home for the day. And it had a checklist of things that he needed to take home for that day. And it was, flyers, textbooks, assignments, your musical instrument, all kinds of things like that. And he would then be able to check them off himself as he packed up his backpack for the day. And then when he got home, his parents rewarded him for the things that he did bring home. A similar process could be used at home for packing up, or as part of the evening routine for packing up and getting ready for the school the next day. Like, okay, do we have what we need? Check, and making a checklist of it. There's one other thing I was going to say about that. Of course, this is an older student. With younger students, there may be a teacher, like a kindergarten teacher, is going to be more hands-on with those kiddos, especially with flyers that or announcements or whatever. They're going to specific, at least at our school district, they have all of the our elementary school, all the kids have folders, and at the end of the day, the teachers are really, especially for younger classes, that everything needs to go into your Buffalo folder, and make sure that your Buffalo folder goes into your backpack. So I think it really depends on the age of the kiddo, and really using your teacher as part of the team. Let's see. I was also going to talk about getting it's not just getting it home, it's also getting it back to school, right? Like, how do we make sure that everything that the kid brings home, you sign off on, how does it get back to school? Again, having a getting ready for school checklist that would include things like, is my homework completed? Is my homework in the appropriate place? What all needs to go back to school? Do I have my homework? Do I have my notebook? Do I have my folders? Do I have my library books? Do I have my permission slips? I think it's really, really important to meet your child where he or she is at and work on building these skills by sitting down and explicitly talking about this goal behavior, saying, hey, buddy, I know this is hard. It's hard to remember all of these things. And so we're really going to start working on it. And here, we're going to create this checklist, and every day, whether it's on a Chromebook or a physical checklist that's on his desk. And when the teacher says it's time to pack up for the day, he has to go through his checklist to bring it home. But I think it's really, really important to, we don't want to just do it for the kid. We don't want the teacher to just do it for the kiddo. We need to set it up so that the kid is starting to do those things on his or her own, so that they can become more independent, especially as they're getting older. Okay, I think that's all I had for that one.
Okay, thank you. The next question we have is, my little guy signed up for T-ball, but had a tough time because his mind would wander and he didn't always listen to his coaches. How do you communicate with sports coaches about son's ADHD?
I think this goes right along with the other one. Well, first of all, if you've ever been involved in T-ball, you know that most of those little people are just out there wandering around, kicking dirt and playing with rocks, and it can be quite adorable. But more often than not, T-ball coaches are parents just like you and me, and just be honest with them up front. When my boys were younger, my husband and I coached their T-ball team. And we were really, I felt like it was really important just to let's teach them some basic baseball skills. It's not competitive at all. It's supposed to be fun. We just wanted the kids to have fun, um, hang out with a bunch of kids their own age, learn like the basics of baseball and enjoy themselves. And so I feel like it's really important for parents to really have a good understanding of what do I want my kid to get out of this experience. Do I think he's going to be a famous baseball player someday, or is this just something I want him to learn something about being on a team and learn the responsibility of going to practice even though you're tired and you're hot and you're cranky, that you're part of a team. What do you want them to gain out of this experience? And then be clear with your coaches up front. What are you hoping your kid gets out of being on the team? In Topeka, there are places where teams are clearly marked as recreational, whereas others are more competitive. Put your kid, if it's going to be for fun, let's put the kid on a fun team. If it's more competitive, that's another whole ball of wax. But like if it's a recreational team, let's make sure that it is fun. Get to know your coaches and the other parents involved, and find people who are, find other parents in your league who have a similar view of what being on a team is about, so that you can kind of form a cohesive team and continue that ongoing. And also, you can set some specific goals for your child. Let's talk to the coaches about, I just want him to play one inning. Can he bat twice and play one inning? Can we get him to focus on practice for 5 minutes at a time? And probably the most important thing is be there. As a parent, you be there and assist the coach and other parents for your kids' practices, their games. Show your investment in what it means to be a kid, what it means to be on a team, and model that for your child. But yeah, I think if you talk about it up front, we don't expect a lot out of him, or this is what we're expecting out of him, and we just want him to have some fun. Great. Coaches will be, I think most coaches who are parents will just be like, sure, that's what we're going to do, especially if they're really little. Excuse me.
Thank you. I appreciate that answer. I'm starting to venture into the T-ball world with my little guy, so I understand all 5-year-olds. Their attention span is not very long. The next question we have, I think you kind of answered along with the first question, but if you have anything to add to it, or if not, we can just go on to the following question. But this one says, how can I help my child get his homework done, completed, and turned in?
Yeah. Again, many kids have struggles with getting their homework done and turning it in. It can stem those kinds of issues can stem from problems with attention to problems with organization. So it's really helpful to have an open conversation with your child about what is it about the homework that he's struggling with. Is it I don't understand the material versus I can't sit still. I've been sitting all day in school. I can't sit down and do more work right now, versus I don't know where my stuff is. I don't know where my book is. I don't know where my pencils are. So is it organization? Is it activity level? Is it problems with attention span? And then what is the problem with getting it turned in? Because I know lots and lots of kids who do their homework but never turn it in. So I think it's really important to have a very open conversation with your child about what is hard about this, and then brainstorm about how to better manage homework in general and what specifically will help your child be successful. And so to have a general plan of attack, kind of what I already mentioned about getting things ready and prepared for the day to come home or to go back to school. But sit down with your kid and we're going to make a plan. And the plan, we're going to make a plan for getting how to get homework done. It's a good way to, it's a good work ethic to establish in a kid about planning ahead, scheduling time. And I recommend having a homework plan for your child. And the plan could have, several steps. So your child comes home from school and you immediately have them sit down and work on their plan with you, which is to write down what all assignments they have. Most of the time, teachers have kids already do that in class. So it's written down somewhere in a planner, or they have a homework sheet that they write it all down on. So it's all in one place. So that's a great place to start. The second step would be to help the child identify what materials do I need, and do I have all of those materials? So do I have the book that I need? Do I have pencils, papers, rulers, whatever other items they might need for each assignment? And then help your child determine, will I need assistance? Oh, math is really, really hard for me, so I'm going to need mom to sit down with me at math. Or boy, mom really stinks at math, so I'm going to need dad or Uncle Joe or whoever to sit down and help me with my math homework. So identify, will I need help? Will I need help, and who is going to help me? The next one is a little harder for not just kids, it's hard for adults too, but I feel like it's really an important step to start establishing more executive functioning skills in your child. And that is to help them estimate how long each assignment is going to take. So we're really bad at that. Humans in general are bad at that. I remember studying in Psych 101, there was a research study where they asked participants, so you have to read this chapter tonight. How long is it going to take you to read this chapter in this textbook? And inevitably, the participants wildly underestimated how long it was going to take them to complete that reading. And so I think it's a good place to start to really gain a self-awareness about how long tasks will take the individual. And so just putting a rough estimate, how long do I feel like this is going to take? Is it a one sheet of math problems? Oh, those usually take me 15 minutes to do, 20 problems. Okay. I have to read this 2 chapters in my storybook, my chapter book. Okay, that'll take us 20 minutes, just kind of giving a rough estimate. I feel like it's really helpful. It's to build on their skills. And then to kind of estimate how much time, like write down the times that he needs to start each assignment. And then the kiddo, usually we would do this, the adult would be doing this with the child, but eventually we want the kid to be doing this on his own, but sharing the plan with the adult to help make it more realistic, to point out, oh, maybe this one's going to take you a little bit longer. Oh, Uncle Joe's not available to do your math, help you with your math. Maybe your brother can help you, that sort of thing. And then the adult's job is to cue the child, hey, it's time to get the homework started. Remember, you wrote down we were going to start doing homework at about, you think you might have about 2 hours worth of homework, heaven forbid, but you have a half an hour of homework. Okay, we're going to get started at 6:30. It's 6:25. It's time to get your stuff together and sit down and get started on it. And then just monitor your child's performance and give a lot of reinforcement for what they do get completed. Initially, a kiddo may need a parent to sit there right there with them. Kids with ADHD, sounds weird, but they need to borrow your brain, right? Their brains are just kind of scattered and they're not developed, and they just need an adult to sit there and so they can borrow from your attention and to really help them stay focused. And so they might need you to sit there initially from start to finish. And eventually you're going to say, okay, you have 5 more problems. I'm going to go start dinner, and I'll be back in 5 minutes to check on how you're doing on those 5 problems. And you come back 3 minutes later and see where are they? How far along have they gotten? But again, you're working on building. I think of it as building a muscle. You're not, or if you're running a marathon, you wouldn't just go out and run a marathon. You're gonna do small increments to build up those skills, build up that muscle. And it's the same thing with kiddos with ADHD. Is okay, right now we know that you can focus for 10 seconds at a time. That's great, buddy. I'm going to challenge you. I want to see if you can. I want to see if you can focus on your homework for 15 seconds at a time. Set the timer and let them go. And can they sit there and do it for 15 seconds? Hey, you did it! And just to show them, to give them opportunity to build those skills and to increase their self-esteem. But the goal is to help your child do this with less and less adult monitoring. So you may start out sitting right beside your child from start to finish, and then work towards moving in and out, and eventually just being able to come in and check on them occasionally. Hopefully that wasn't too repetitive, but yeah, that's how you help with homework.
Yeah, I think that's very, very helpful. Our next question is, at what age can ADHD be diagnosed?
According to the Diagnostic and Statistical Manual of Mental Disorders, which is the DSM that we use, it lists all of the mental health diagnoses that we utilize. Currently, we're in the DSM-5, the 5th edition. ADHD obviously starts in childhood. There is a requirement that several symptoms must be present prior to the age of 12 years. That age level has changed over the years with the different editions of the DSM. And the reason it's changed is because researchers have come to realize that adults' recall of childhood symptoms tend to be unreliable. So in past, I think it was the DSM-3R, the 3rd version. I think it said that the symptoms had to start prior to age 7 or 8. It's changed over time, but again, our memories are bad as humans. We just have bad for those kinds of memories, and so trying to recall our childhood experiences, they tend to be unreliable. And so what's more important, I think, than what age can it be diagnosed is that you compare your child to his or her same age peers. So let's say you have a 4-year-old who, with COVID, we're talking a lot about these COVID babies who really haven't been around other kids their age yet. And now we're starting to kind of get them into schools, and they're really struggling. Let's look at how he compares to other 4-year-olds. Is he as active? His attention span is short. Is he as forgetful as other kids his age? Let's compare him to other kids in his or her kids in her classroom setting, or daycare, preschool setting, before we start jumping onto, oh my gosh, he has ADHD. Let's compare him to other kids. Let's see how he interacts with other people, other kids in his classroom and stuff. Also, it's really, really important for folks to realize that ADHD symptoms must be present in more than one setting. It's not just going to happen at school. It needs to happen across settings. So it needs to happen, problems with attention or hyperactivity or impulsivity needs to happen at school and at home and at Cub Scouts and at church and on the baseball field. I mean, it happens across setting. It's not isolated to one particular setting. So for us, I think as a clinician, it's really important for me to get some consultation from school staff to know how is the child functioning in the classroom setting too. So there's no easy answer to at what age can ADHD be diagnosed. There's no easy answer to that, but I would recommend asking teachers or watching your child in a group of kids his own age and see how his behavior is compared to other kids.
Okay. Our next question is ADHD genetic? If I have one child with ADHD, will the rest have it too?
Is ADHD genetic? Yes. ADHD is elevated in first degree biological relatives of individuals who have ADHD. So that is adults who have ADHD or had ADHD as children are more likely to have children with ADHD than adults who don't have ADHD. However, there are tons of variables that can influence the presence or severity of ADHD symptoms. And just because you had ADHD as a kid doesn't necessarily mean that your child is going to have ADHD. And just because one of your children has ADHD does not necessarily mean all of your kids will have ADHD. There's so many other variables that can impact the development, or I guess lack of development, brain development in kids. So there's no firm answer on that. Yes, there is a genetic predisposition. We do know that parents, actually, we kind of do it backwards now. We see kids who have ADHD and we go and interview their parents and discover, oh yes, their parents had ADHD issues as children. So yes, there is a genetic component. Does that automatically mean you're going to have? Does it automatically mean, oh yes, that child is doomed to have ADHD? No.
So to kind of tack on that, you mentioned a parent having it. So is ADHD something you can outgrow?
That is also, I think, one of our questions, right?
I don't see it on the list, but I could be overlooking it.
Yeah, it was one that I answered. It was one that I answered for our preliminary videos.
Okay.
Yes. The question is, my daughter's been diagnosed by doctors as having ADHD. At our last parent-teacher conference, her teacher said that my daughter would grow out of it. Is that possible? Could she simply grow out of forgetfulness and inability to stay focused when she's older? And that is possible. ADHD comes in all different sizes, severities, intensities. We could have 10 people in a room with a diagnosis of ADHD, and their symptomology is going to look very, very different. It could be primarily hyperactive or impulsive or inattentive, or really having struggles with organization, or excuse me, forgetting things, forgetfulness. Is it possible to grow out of it? Yeah, especially it's possible to grow out of it, especially if behaviors aren't too terribly severe, and if family and school members help work on specific skills related to whatever the challenge was for that kiddo, so that they develop the skills that they need, which helps their brain develop, which gives them more confidence. And but again, it depends on the severity and the pervasiveness of the symptoms that the child is experiencing.
So for everybody tuning in, what we were referencing is each week leading up to the final Q&A session, the clinician will release Facebook videos where a question has been asked on the topic. So that specific question had been one that had been asked earlier this month, and Dr. Romig had answered on Facebook for us. So that's something that you can go back and check out when you have some time. And they're just a couple minutes long, quick little snippet for you to listen to. Our next question is, can ADHD affect kids when it comes to making and keeping friends?
Yes. ADHD behaviors can impact a kid's ability to make and keep friends for sure. In fact, one of the criteria for diagnosing ADHD is that there's clear evidence that symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So many kids have ADHD type behaviors. I have ADHD type behaviors. I probably had ADHD when I was a kid. I probably have ADHD now. But how does it impact their day-to-day functioning? Some people can still thrive despite having problems with attention or forgetfulness or impulsivity or whatever. But a piece of it is, does the symptoms impair social functioning? And that's interacting with other people, interacting with peers. Some kids with ADHD are very social and very friendly. They make friends easily. They have little inhibition. They'll walk up to new kids on the playground and, hey, let's play. They're not shy about things at all. Excuse me. Other kids, will struggle with impulsivity, which then impacts the peers that they're trying to play with, right? So a kiddo with ADHD, they may be playing kickball with friends, something doesn't go the way the kiddo thinks it should go, and they may impulsively blurt out that they don't want to play anymore, you're not my friend anymore, so that can definitely impact his or her friends around him. But it really depends on the individual, and therapy goals can certainly focus on working with the individual child on pro-social behaviors, whether it's social skills, turn taking, frustration tolerance, even as far as anger management, to build those skills. So just because ADHD can negatively impact ability to make friends doesn't mean it's always going to be that way. We can actually work on those skills in treatment.
Thank you. Our next question, I think, is one that a lot of people are probably curious about, is can ADHD be treated without medication?
Yeah. Like I said, ADHD can vary significantly across a wide array of people as far as the severity and intensity of the behaviors. And so, yeah, some kids may have some slight problem with attention span that they don't need to use medication. I have a whole book here called ADHD, Non-Medication Treatments and Skills for Children and Teens. It's a workbook that I went to a webinar that focused on how do we help kids when they don't want to, when parents and children don't want to use medication. But like I mentioned with the friend question, we can definitely have kiddos working on specific skills and treatment without the use of medication. We know that ADHD medication has long been the traditional treatment, and it can be very, very effective. However, most therapists, most of the staff even at FSGC, we would encourage parents and children to pursue at least some therapy work, if not start with behavioral interventions before we go to medication. Most people don't want to put their kid on medication, and that's okay. And we can work on some specific skill sets, whether it's with or without medication. We can try some behavioral interventions first to see if those will be effective with the types of symptoms that your kiddo might experience. And then we can have a consultation about whether medication is needed or not. For many kids, therapy and medication together is the most effective treatment for ADHD, because it's kind of like, you can kind of think of the medication as a Band-Aid. So yes, the medication is helping my child stay more focused right now, but when he's off his medication, we have not worked on developing any skills for him to utilize when he is off his medication. So if he goes off his medication and he hasn't worked on any skills, then he likely isn't going to have any skill, and he's not going to develop any. The medication isn't going to help him develop those skills. And so So yeah, we would recommend that you do both together. So like, I have some kiddos who, we get them, they get on a little bit, just a little bit of medication, just to take that edge off, so that they slow down enough to really process and really um, process and fully understand the skills that we're trying to teach them. Some of the non-medication therapy interventions can focus on things like teaching mindfulness, again, which is helping them slow down, become more self-aware. Building self-esteem is a big one. Kids, poor self-esteem is not a symptom of ADHD, but it is a side effect of ADHD, because these kids cannot focus, and so they're constantly being redirected. Well, if your boss is saying you're not doing it right, pay attention, what are you doing, how would that affect your self-esteem? So these kids often struggle with self-esteem issues, so we want to build their self-esteem. We want to practice to improve concentration, and it's just like I said, just like running a marathon. We're going to do a little bit at a time and practice those, you work those muscles and build up those muscles to help them concentrate and to manage their body, again, to develop more self-awareness of where their body is in space. We can work on relationship skills, organizational skills, and improving sleep patterns. Again, sleep is not an official diagnosis. Sleep issues are not an official diagnosis, an official criterion of ADHD, but often kids who have ADHD have problems with sleeping. And so they have poor sleep, therefore their behavior is bad. And then they have more poor sleep, and then their behavior is bad. And so we work on sleep hygiene somewhat. And we also work with parents on specific parenting skills, because kids with ADHD need extra support. They need extra guidance from the adults around them. And so there are some specific things that parents can do to help their kiddos break things down into smaller steps, make goals more achievable, learning where to challenge your kid. We never want to challenge a kid here. Like if they're functioning here, we don't want to challenge them up here, because why try? I'm never going to make it. We want to challenge them here. And that's where self-esteem comes in. Look at what I did. I did it. I did it today. I did it again yesterday or the day before. That's what builds self-esteem, is those experiences of success. So the original question was, can ADHD be treated without medication? Yes, it can, but it depends. It depends on the types of symptoms, and the severity of the symptoms that your child has, as well as how dedicated of a team your child has around him. And that includes parents and school, as well as mental health professionals.
Okay. Our next question is ADHD a real mental health challenge, or is it a problem with parenting? I think as parents, we put so much pressure and are so critical of ourselves. So I think this question is really good.
It can be a bit of both. We do know research tells us that ADHD is related to brain development and brain functioning. We know that it has to do with not having enough of certain neurotransmitters or having too much of other neurotransmitters in the brain. So people with ADHD have real mental health challenges that need specific parenting that I just alluded to. Again, severity of ADHD behaviors or symptoms vary significantly across children. And some kids can do okay despite the challenges that they experience, while other kids need intense interventions, or there's, anything in between that. And so it is important for a child to receive a thorough assessment involving the caregivers, so that that your mental health providers can develop a plan to meet that individual child's needs. And then we can also help support parents in parenting that individual child. So, excuse me. Sometimes what can happen is, a kid is, in preschool or kindergarten, and we notice, hey, Johnny's struggling to sit still in class. He's getting up a lot more than the other kids. He's not able to really focus on the work like the other kids. And the parent, whoever's taking care of Johnny, his caregiver, is getting frustrated because the things that the adult is trying to do to help Johnny succeed isn't working, and so that parent may be pulling back. And what Johnny really needs, and the parent really needs, is kind of lean in more, and the parent needs some additional supports. Let's kind of help. We need to. That's when to ask for help. Is when you're feeling like, I don't know what to do anymore. I don't know. I've tried all of the things that I know to do. That's when you coming and consulting with a mental health professional might be a good time. It might be a good time to do that, just to get another person's perspective, to get some support, to have somebody to talk to just to be able to say, gosh, this is so frustrating. Also to, if you need to talk about your parent guilt, because like Megan mentioned, we all kind of feel guilty as parents. We're hard on ourselves when something's not going quite right with our kids, or our kids aren't functioning where the other kids are. So the answer to that question is it can be a bit of both. But we do know that it is based in brain development. ADHD is some people actually consider it part of the developmental delays. We can, in the DSM, it's actually called a neurodevelopmental delay disorder. So, but also a kiddo with some mild ADHD type symptoms can still do really well and thrive with a really supportive, informed parent. And so it can be a little bit of both, I guess.
Okay. Our next question is, what causes ADHD? Are there specific causes? And I think you just kind of hit on that with neurotransmitters, but I'll let you elaborate some more.
Yes. Like I mentioned before, there seems to be a genetic component. There tends to be a imbalance of neurotransmitters in the brain, but where does that come from? Genetics may play a role, but there are many, 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 many other variables in the development of ADHD symptoms, and that can include brain injury during childhood, a parent using alcohol or smoking during pregnancy, exposure to environmental risks like lead or other kinds of toxins, premature delivery and low birth weight in newborns can also be correlated to later ADHD. May not be causal, but it's definitely related to later development of ADHD. So there's lots and lots and lots of variables that go into the development of ADHD. So people need to give themselves a break. Parents need to get off their own backs, and stop beating themselves up. And we accept the kid that we have, and we parent the kid that we have, and everybody's going to just try to do their best with the behaviors that we see. So there's lots of variables involved with where ADHD comes from, I guess.
Okay. If you guys that are tuned in right now have any questions, feel free to drop them in the chat. As I mentioned before, we had a few questions posted earlier in the month on Facebook, so you can go check those out. I'll wait just a couple more seconds to see if there's any questions. As a reminder, this is recorded. It'll be up on our website in the next day or two. To get to that, like I said, we have a new website that just launched this week, so we're very excited about that. You can visit fsgctopeka.com/parental-resources. On that page, you will also find a library of all of our previous videos. This series was previously called Real World Parenting. And so there's many different topics uh, from the past. Next month's topic is anxiety, and that'll be on Thursday, April 27th, also at 6:30. You can check our Facebook page for that link. And once again, you'll just tune in on Zoom. We want to thank Dr. Romig for sharing her knowledge with us. And I want to thank you all for joining us. I hope we offered some information that you can take away to help with your child or teen. And we hope to see you again. Thank you.
Thank you.